Thanks so much, Tawana. Well, it's Tuesday, which means we're talking health today, and this month is National Stroke Awareness Month. This morning we're joined by Dr. Jimmy Miller, who's a neurosurgeon with the Greenwood Leflore Neurosurgery Clinic. Good morning, Dr. Miller.
Good morning.
How are you?
Great.
Hey, this month, National Stroke Awareness Month, and specifically, I was curious if we could chat with you about brain-type strokes.
Okay.
But when I was prepping for this, I found out a little information, which is really interesting. Typically, when we talk about the brain, we think cerebral, but there's actually a difference between the cerebral area and actually where you get the strokes in this area. Is that correct?
Well, we're talking about cerebellar strokes today. The cerebrum is what most people think of as the brain. It's the upper part of the brain. It has the two hemispheres. The cerebellum is in the posterior part down below. So in the posterior fossa, there's a cerebellum and a brainstem that are below the cerebrum, but they're all critical.
And these are areas that really have complications for strokes. And
yes.
When you're dealing with that, there's basically two types. Can you explain those two types? Yeah,
the two basic types of cerebellar strokes, one would be a hemorrhage or a hematoma developing in the cerebellar tissue itself. The other is an infarction where the blood supply is cut off and the cells inside there die off because they're not receiving blood and nutrients.
Now, am I right in saying that the hematoma is an influx of blood and the other one is a loss of blood?
Yes.
Is that right?
Yes.
And so let me ask this, going over the two types of strokes, what are the frequent causes that cause those two?
Usually the infarction where the blood supply is cut off is the basic process is atherosclerosis. Whereas with the hematoma or the hemorrhage into the tissue, it's usually hypertension.
Now when somebody experiences both of those, what do they feel? I mean, we've talked about in the past how to recognize a stroke, but when something like this happens, what are some of the symptoms?
In the cerebellum, the patient will oftentimes develop a headache. They may have nausea and vomiting. That's fairly frequent. And also they'll start to develop difficulty with motor movements, with coordination. They have difficulty reaching for their coffee cup. They have difficulty walking. Right. So the coordinated movements will be lost. You can still move, but it's not coordinated.
It's not, yeah. When somebody comes into the hospital and they're facing you and you're looking at this, how do you treat these?
The neurosurgeon basically is there if there is developing a mass effect that's compressing the brainstem. The brainstem maintains blood pressure, it maintains respirations and things. So what we're trying to do is take some mass out. So we'll operate and take out some of the blood clot or some of the infarcted tissue to allow a little more room inside that area to keep from compressing the brainstem. Now
if somebody comes in and they're dealing with this type of stroke and they come in and they have surgery, what's life like on the other side for them?
Well, we're just taking the mass out. They still have damaged tissue, so they still have to get over their infarction or their hemorrhage. So they still require medical treatment, blood pressure treatment. They may well require rehabilitation, and they may have lasting deficits.
And Doc, let me ask this. Is there something that folks can do to prevent these type things?
Well, the main thing would be managing, if you're diabetic, glucose control, watching hypertension. That's extremely critical. Not smoking, the basic nutrition. So the simple things that we tend to ignore in everyday life.
And just make sure you take care of those in case. But if they need to come to somebody, it's great to come to somebody like you who knows and cares and has the details of how to take care of all that. May 25th, National Stroke Awareness Day. I hear that you guys are going to be on hand to talk to some folks who are coming in.
Yes, I think it's a pretty much all-day occurrence.
All-day occurrence happens at Greenwood Leflore Hospital. May is National Stroke Awareness Month. So if you'd like more information right here from Dr. Miller or some of the other doctors, be sure to show up at Greenwood Leflore on May 25th. You'll get all your questions answered. And Doc, thanks so much for being here this morning to educate us.
Thank you.
Stay with us. We've got more coming up after the break. We'll be right back.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.